eCaring is a web-based home health care management and monitoring system that enables home caregivers, whether it's a paid home aide, a family member, or the care recipient themselves, to enter enormous amounts of information in real time about the care, conditions, status, and activities of a home care recipient. In doing so, we let people stay at home longer with greater comfort, more affordability, at lower cost, and stay connected to the family and friends, the people they love. Nobody is ever prepared for this terrible transitional moment when you realize somebody that you love requires more care. And when you do that, you go through a series of in and out of hospitals and nurses' assessments and then all these kinds of things, and they lead to the moment where you're basically handing over the keys to mom's house to a stranger, a well-meaning stranger generally, but nonetheless somebody you don't know. That door closes and that home becomes a black box, and you cannot find the most simplest of information, the answer to the question, what's going on?
Families are very frustrated with the healthcare system. Caregivers are very frustrated with healthcare. They cannot access their healthcare providers. They can't, they think that visiting nurses are going to do more than they do. Home care workers are very limited in what they're allowed to do by law and their clinical skills. So often it's the family member who's left trying to piece it all together and become the glue that holds it all together and has their own issues and their own job and their own children and can't really deal with the situation effectively, and also don't have the knowledge or the education or the expertise, and no one really helps them with that. No one tells a daughter what to look for, what are the warning signs, and then they don't even know how to put it all together. So it's just easier in a system like eCaring where I get raw data and I know how to put it together. And that's much more appropriate than asking a family member to take on that responsibility.
Current systems essentially use primarily paper forms that somebody fills out. They're used primarily, frankly, for reimbursement purposes, and they are useless diagnostically to say, okay, I need to intervene now in order to make something better before it gets really worse. There's no system that enables you to do that other than eCaring.
Main issues in physicians dealing with the home health care system or other health care providers is a great disconnect. The right hand doesn't know what the left hand is doing, and it's just mounds of paperwork that don't amount to any difference in what happens to the patients.
eCaring really enables patients to stay at home longer and at lower cost. And it does that because with eCaring you can establish what's normal for a patient, then you can see trends as they emerge so you can respond to them quickly, and you can be notified immediately with alerts if a situation requires your attention right away. So in doing so, for example, you can prevent small problems from becoming big problems. And if you can do that, then you can avoid the hospital visit, the emergency room visit, the use of the ambulance, more medications, and the necessity of moving somebody from their home to an institutional care setting, a nursing home.
One of the tremendous values of eCaring is that it allows you to see what's happening to a patient day to day, and then to be able to analyze that information over a period of time, be it a few days or be it a week. So things like not eating or not sleeping or losing weight can be very subtle from day to day, but if you can look at that data over the period of a week, you'll begin to see a pattern of events that you as a physician will recognize as either going in the direction of further illness and danger and heading towards a rehospitalization, or actually that the patient's getting better, so you know you're on the right path.
With eCaring, you can get that information on your computer, you can get it on your tablet, you can get it through your phone, and you can see by the day, by the week, by the month, all of the activities that are going on, all the information that's entered about what's going on in that home care recipient, your loved one's life.
Absolutely, eCaring can save lives, and I think I've given you several examples of that already, where a patient, an older patient with multiple medical problems, for example with a fever, can easily become septic and die. A fall can be a very sentinel event. A patient can die from a fall. They can have head trauma, many other things. They can puncture a lung, they can break their ribs and puncture a lung. And if you get that patient care immediately, you can decrease mortality and morbidity.
The information eCaring generates, it can be given, because it's web-based and uses the internet, it can be shared and reviewed by anybody involved with that home care recipient's life. So it can be their doctor, any other providers, it could be a case coordinator or a case manager at an agency, and of course it's the family and friend members, because all the evidence indicates that collaboration with providers and family members leads to the best outcomes.